Well, good afternoon, good evening, good morning, or whatever time it is in your part of the world. Thank you for joining us. We are going to begin the webinar in just a few minutes, but I want to give people a chance to get logged in and get situated, get comfortable, get your coffee, or soda, or whatever snack you've got with you tonight, or this morning. Maybe it's orange juice, I don't know. So just everybody, as you start joining here, keep in mind that we do have a Q&A at the bottom where you can enter questions, and we will save time at the end, so that, and I will share your questions with Dr. Ward. So if you do have a question, go ahead and type it into the question box. I will be sending out some information through the chat bar, so please check that. It'll have a link, for example, to donations, where you can make donations. And in the meantime, just let me give people about a minute or two here to get joined in and get settled in. Once I finish the introduction, I'm going to go off camera, but I will be handling everything on the back end. So if you have a question, if you're having a problem, please jump in and ask. Oh, good question. I already have a question. Can I ask it real quick?
Mm-hmm.
Is it really okay to use a human monitor versus a pet-specific glucometer?
Yes, absolutely.
Good answer. Okay.
That was quick.
Yeah, those are great. I like those. Got that one out of the way in a hurry.
And the Alpha Track is nice because it takes much less blood, but and the Alpha Track is probably a little bit more accurate, but realistically, it doesn't really matter. So if someone will use a human glucometer, that's fine.
I remember the days when that was all we had.
Yep. Me too.
All right, so we're just about ready to start here. I'm going to go ahead and start the introduction and then turn it over to Dr. Ward, so that we have time at the end to get to as many questions as possible. So I'd like to introduce Dr. Cynthia Ward. She received her VMD and her PhD degrees from the University of Pennsylvania, hence the VMD and not the DVM. They're special. Sorry, I always have to take that. She was on faculty at the University of Pennsylvania and the University of Georgia. She has since retired as faculty at the University of Georgia. Probably her most proud accomplishment is she is the founder and director emerita of the UGA Veterinary Diabetes Clinic, which was the first diabetes clinic in the country. Is that correct?
Yeah, actually, it was in the world, believe it or
In
not.
the world.
The first
All right.
ones. Yeah. Yep.
All right. She is a diplomate of the American College of Veterinary Internal Medicine, Small Animal. And with that, I am going to turn it right over to her.
Wow. I'm so thrilled to be here, and I'm going to turn my camera off now that I've said, well, let me say hello to everyone who's there. I'm really excited to be here. And very honored to get the opportunity to talk about something I love, which is diabetes. I know that I have a wide audience here in terms of people with different interests. And hopefully I've made this understandable to most of you, but we should have time at the end for questions, which I am delighted to address at that time. I'm actually going to turn my camera off if I can figure out how to do it, because it will be easier in case they have to edit it, and then you don't have to look at my face anyway, because we have cute cats and you'd much rather look at them. So I am going to do that if I can figure out how to do it, which I think I did. Yay. And that way, if they need to edit this, it will be easier for them. Okay, so we're going to get started. And we're going to be talking about caring for the diabetic cat, and basically what is new in 2023. And I have to tell you, it is an exciting time in feline diabetes, because we have so much new stuff. We have a new drug class that's come on the market, which I'm so excited about, because I believe it's going to save lives in our diabetic cats. So I'm trying to convince you to hang in there and listen to this. Not only do we have pictures, lots of pictures of cute cats. We're going to be talking we're going to be talking about diabetes mellitus, but let me tell you how I've approached this. I have to do a little bit of pathophysiology because we need to understand the way that this new drug class is going to work. And to do that, we've got to do some pathophys. So I apologize about that. But I've got to go through a little bit so we can really understand how these drugs work. We're going to talk about the difference between dogs versus cats and why cats are special. We know they're special. They know they're special. And we're going to talk about why diabetes in cats is special. We're going to talk about traditional treatment options and the problems with that. And then again, probably spend most of the time talking about the new treatment drug class that's out there on the market now, which is just amazing. So let's start talking a little bit about diabetes mellitus. And in our dog and cats populations, we have two different types. We use the same terminology as they do in people, recognizing that there are certain differences between what is seen in people and what is seen in cats and dogs, but it's roughly the same. And as a veterinarian, it helps me relate to my clients when I can tell them, when I can use the same terminology that they already know. Diabetes is such a common disease in people right now that it is that many people either know somebody who's diabetic or are diabetic themselves. And so to use the same terminology, I think is helpful to help people understand the disease. So dogs, for the most part, get type 1 or insulin dependent or juvenile type diabetes. And this is the easy form of diabetes. So I have a little cartoon here. Here's your pancreas in cartoon form. And most of it's devoted to helping you digest your food. It secretes a lot of enzymes that helps you break down proteins. But interspersed throughout the pancreas are these areas of happiness, as I like to think of them, which are the islets of Langerhans, and they contain all the endocrine activity of the pancreas. The majority of the cells in the islets of Langerhans are beta cells, and they secrete insulin. So what happens with type 1 diabetes is that you have, and we believe for a variety of reasons, it's an immune-mediated attack. It's similar to what's seen in people. And those beta cells are taken out. So basically, they're attacked by the immune system. They're taken out. They cannot secrete insulin. And so basically, these guys have, again, what is very similar to insulin-dependent diabetes mellitus in people. Okay, so that's type 1, insulin-dependent. Then we go into our cats, and cats are special. We know they're special, and they have a more complicated form of diabetes mellitus. They tend to get type 2 or non-insulin dependent diabetes mellitus, which is the type of diabetes that's on the rise in human medicine right now, that's related to lifestyle and obesity. And those are the same things that actually are risk factors in our cat population as well. So what happens here is different. Your pancreas is fine. Your insulin secretion is fine. The problem is at your terminal cell, your terminal receptor. The major targets for insulin are muscle, liver, and fat cells. But regardless of the cell that you have, the insulin receptor here decides that it's not going to recognize insulin anymore. So basically, insulin does not bind or activate this receptor, which means glucose does not go into the membrane, and you can't get glucose into the cell. So this is really an insulin resistance phenomenon. And initially, your pancreas responds, your beta cells that are secreting the insulin in your pancreas responds by saying, I got this. I know that they're still really hyperglycemic and the cells are hungry because they're not getting any glucose. I know what to do about this. I'm just going to work harder. And they do. They secrete more insulin. So you get kind of a compensatory increase in insulin secretion, and you can maintain normal glycemia for a while. But over time, these beta cells get tired and they are less functional, and you get a decrease in beta cell functional mass, meaning just you get a decrease in the number and size of beta cells that can actually work and secrete insulin. And because of that, you get a relative insulin failure, hyperglycemia, and what we recognize as type 2 diabetes. And this is really a phenomenon of pancreatic beta cells and the way that these beta cells work. Other endocrine cells are a lot more hardy, but beta cells, there's a lot of stuff they don't like. They don't like being in a high glucose environment, which happens when you're diabetic and your insulin isn't working correctly. So you can secrete all you want, but you're hyperglycemic and your beta cells don't like that. They're like, oh my goodness sakes, like this is too much sugar and I'm not happy. They also don't like to work hard. They're kind of like a teenager. They don't like to work hard. So when you ask them to make more insulin and secrete more insulin, they're not happy. So they actually undergo a phenomenon called beta cell burnout. There are several phases of this that are described in human medicine. And we don't know all the phases that cats have, but it's probably a progression of disease where they actually burn out and they have less. This is a beta cell with little insulin molecules in there that are getting ready to be released. Well, there's less insulin and less of them get released because they're just burned out and they don't want to work anymore. Some of the scientific terms we use to describe this are oxidative stress. They undergo apoptosis, which is programmed cell death. And they can actually de-differentiate so that they get to the point where they don't make insulin anymore. They've gone back to more of a juvenile state of a cell. The end result of this is a decrease in functional beta cell mass. So this is, again, a cartoon of a normal pancreas and a normal beta cell or normal islet of Langerhans with normal beta cells in there. And over time, as these beta cells burn out, and they're asked to work hard and they get toxic from all that glucose, their number and size shrinks so that they're just not a lot of active beta cells. And the end result in a cat, this is actually a histologic picture of a beta cell in a cat with end-stage pancreas or end-stage diabetes mellitus. And the normal cell structure has been replaced by amyloid, which you can see with this Congo red staining, the red stain here. And basically now you don't have any functional cells. And somebody that has beta cells that look like, or an islet of Langerhans that looks like this, they're going to end up being a type 1 diabetic because they don't have any cells that are going to secrete insulin. And then we have our happy diabetic cat. Okay, so one of the important things that happens with beta cells is they can actually recover their function. So we talked about these beta cells that are happy and healthy. You've asked them to work hard. You put them in a high glucose environment, they burn out. And we come along and we say, oh my gosh, I know what to do about that. I can give something called insulin. And we do. And what that does for this burned out cell is that it removes the excess glucose so they're not toxic anymore. And it also says, I'm going to do the work for you and you don't have to work anymore. And these cells actually can then return to functionality. And that's something that we term as remission. And the reason that this is important is when we're looking at this new drug class, the SGLT2 inhibitors, one of the things that we see are we need to have beta cells that can actually return to function for that to actually work. And that is something that we see with this drug class. The other thing that I have seen, I won't spend a lot of time on this, is way too complicated for, I'm sure, many of you to have to think about, and I'm sorry about that, is I need to talk a little bit about ketosis. Because again, this factors into our use of this brand new drug class. There's a bunch of things that are involved in creating a ketotic animal. It's very complicated. But the one thing that I wanted to remind you about is that if you have a ketotic animal, they need insulin. And that's because insulin stops the breakdown of free fatty acids that results in ketoacidosis. And so basically, if you're ketotic, you need insulin, and you need to have some level of insulin to prevent ketosis. And we're going to talk a little bit about that later. Okay. Well, that was the pathophys part. That was the horrible part. And I'm sorry about that. We can take a deep breath and say, phew, that is over with. So let's move on and talk about how we're going to clinically approach the diabetic. So as an internist, I see a lot of patients that I can't diagnose because they have very complicated diseases. And a lot of times you don't figure out like why they have what they have. But with diabetes, it's pretty easy to diagnose. And it's very exciting when we do that, because then we know what's wrong with the animal, we can develop a treatment plan, and we can move forward. But the problem is, so yay, we have a diagnosis, that's exciting. But now we need to treat the animal. And that's where a lot of the problems come in with diabetes mellitus. And remember that when we treat any kind of an animal, or when we have as a veterinarian, when we have any sort of a patient that we're trying to treat, it obviously our relationship with the patient is very important, because we need to know that patient and we need to develop a really good treatment plan. But the other really important factor in this treatment is the owner. Because if you ask owners to do something they can't do, and all of you out there that are owners yourselves, if you are asked to do something that you can't do, you cannot be successful in treating that patient. And one of the things that happens with diabetes is that it can be very complicated to treat, and many owners just cannot do it. And so we really do need to think about tailoring our treatment plan around what owners can do, and be happy to say to ourselves, you know what? Maybe they can't do everything we would like, but if they can do most of it, then that's still a win, because we want to make sure that we do the very best we can for our patient. And that includes getting them on some sort of a treatment protocol that's going to work well for them. And again, we need to take into account what the owner can do. So initial treatment options for the cat are sort of listed here, and I'm going to go through each one of these. The first one is a low carbohydrate diet. They have been shown to be really helpful in diabetic cats. Cats are obligate carnivores. They do not process carbohydrates well, and they do better on a low carbohydrate diet. It can be high in fat, it can be high in protein, hopefully high in protein more than fat, but they need to be on a low carbohydrate diet. And that can really help regulate diabetes mellitus. I will also say that low carbohydrate diets can also help with weight control in a normal cat that doesn't have diabetes. They need to be calorie controlled, and that's another important thing. Cats are little. They do not need a lot of calories. If you give them something like the equivalent of what the calorie count in a chocolate chip cookie, that is probably their calorie limitation for half the day. And I think it's hard to remember that sometimes, that they really need so little food. But we know that obesity is a huge risk factor for diabetes mellitus, and causes insulin resistance. So every time you contribute to a fat cell getting larger because you've overfed them and you've exceeded the calorie limit that they need, you are going to make their diabetes worse. So calorie control is even more important than the certain diet of a low carbohydrate diet. So that's another thing that we think about. You got to limit their food. Some cats are self-limiting, but most of them are not, and they will eat all day long if you let them. Another component is exercise, and there's a huge body of literature, especially in people, that has shown that exercise as an entity on itself helps with diabetic management and carbohydrate metabolism. And we're not talking a lot. In people, they see a significant increase in carbohydrate metabolism when people just walked on a treadmill at like level 3 for half an hour. We did a dog study, and we saw the same thing in dogs that were on a treadmill for 15 minutes at level 1. In cats, it's a challenge to exercise them, but if you can do it, it can make a huge, huge difference in diabetic control. And I'm just going to tell you the story of my own. So I have a foster failure cat, of course, and he's diabetic, of course, and he also has asthma, of course. And when I got him, he had such bad diabetic neuropathy, he couldn't even walk. So we have him on a pretty strict regime, and he's done really, really well. But I do exercise him. So the way I exercise him is he doesn't like to go outside. He likes to be inside. So I'll scoop him up and I'll take him outside to visit the goats in the pasture. And then I walk back to the house and he runs after me to get back in the house. And then we get to the front door and I scoop him up and I walk him out again. And we do that a couple of times every day. And that gets his exercise in. And I believe that that has really helped with his diabetic control. So that's another component. And the fourth component here is what we end up treating most cats with these days, and that is insulin. And unfortunately, it usually needs to be given twice a day. I think these present huge treatment challenges for owners, and running a diabetes clinic for many, many years, I have seen lots of cases that have come in with owners that just cannot deal with a diabetic cat. There is also a body of literature in which people have looked at and actually tabulated questionnaires from owners of diabetic animals and said, hey, what's your lifestyle like? You know, what are the limitations or what are the good things? And there is a litany. In fact, if you look at the chart, almost everything is negative on the chart when you own a diabetic pet, which is, gosh, we don't want that. We want everyone to have a great interaction with their pets. But some of the things that really stand out are changes in people's lifestyles. They have to give injections now, and sometimes it's twice a day, which means they have to be with their pet twice a day. And especially for cat owners, many people get cats as a pet because they don't want to have the responsibility of walking a dog twice a day. Maybe they work a lot or they travel a lot, and cats don't necessarily need to have people around as much as dogs do. So they get a cat. Now they have a diabetic cat, and now they have to be with the cat twice a day to give an insulin injection. Many people don't want to travel because they don't want to leave the cat. They don't have a pet sitter that they trust, and they don't want to leave the cat. And for many people, they don't want to go out to dinner even because they don't want to, they have to be home to give the cat the injection. So many people feel that this is a huge negative impact on their lifestyle. People are also scared. Giving an injection can be scary. You have to pull up a tiny little amount of insulin. Usually you're doing it at least one time first thing in the morning where, I don't know about you guys, but, being sight challenged early in the morning, it's hard to drop a little tiny bit of insulin, and you have to stick a needle under the skin of the pet. And for many people, that's a huge challenge. And oh, by the way, if you don't dose the animal correctly and you give it too much, you might make it hypoglycemic and it may seizure. So I think it's a very scary thing for many owners to give an insulin injection. And then cost. Insulin's expensive. The diets can be expensive, but even more than that, monitoring insulin therapy can be expensive. And so it's not surprising that 30% of pets are euthanized at diagnosis or within the first year when they get that diagnosis of diabetes mellitus. And this absolutely breaks my heart. I'm an endocrinologist for a reason. I started a diabetes clinic for a reason, because I can diagnose them and I can treat them and usually monitor them. And it breaks my heart when people just can't do it. And many people just cannot keep up with this. All right. So how can we help cats? What can we do to help cats? So what if, taking this scenario, you said, okay, I can make your life easier because I can have a once daily treatment. And oh, by the way, you don't have to give an injection. It can be an oral medication. What happens if that's the case? Well, guess what? That creates a huge amount of excitement for me and many people that deal with lots of diabetic pets. To me, the drugs that we're going to talk about and the new treatment options we have are life-saving therapies, because so many people will be able to treat their cats and not have to euthanize them. And the cats are obviously very excited about it too. Okay, so what are we talking about? The drug class that we're talking about are SGLT2 inhibitors. These are drugs that have been on the human market. They were FDA approved for human use in 2013. There's a bunch of them on the market. They all end with gliflozin, and so, which is very hard to say. I had to practice saying it, but they all end with gliflozin, so you know that those are all SGLT2 inhibitors. Probably the one that you may recognize the most is empagliflozin or Jardiance. It's a pretty popular medication. And I will say that bexigliflozin was approved for human use in, I think, February of 2023. And the cool thing about that is it actually got approved in cats first. It was approved in December of 2022 for cats. So that was really exciting because it's one time where we actually beat people. All right, so you've got an SGLT2 inhibitor. What in the world is an SGLT so that we know what we're inhibiting? All right, so these are sodium glucose linked cotransporters. And there's two main ones in the body. There's an SGLT1 and an SGLT2. And their job is basically to transport glucose. So they're responsible for glucose reabsorption mainly in the small intestine and the kidney. And SGLT1 works mostly in the small intestine. SGLT2 works mostly in the kidney. So I have a little cartoon up here about how these work. So basically what they're going to do is they are going to transport glucose and sodium from the outside, whatever lumen you have, whether it's your GI tract, like your gut lumen, or whether it's a lumen in the kidney where you've got urine passing. They're going to pull glucose out of that lumen and transport it into a blood vessel so that you can actually reabsorb that, meaning that you're not going to lose that either in your waste, like your GI waste, like your poop, or in your urine. So you're not going to lose it in the kidney, in the urine. So these are important proteins, and we know that because the body has invested energy to make these proteins work. So they require ATP, meaning you're taking energy to make them work. Sodium is pulled in with a sodium potassium pump, a very common mechanism to get sodium into cells, and it pulls glucose with it. And then glucose is transported into, and this picture here is a blood lumen, but it's going to be similar to going into the interstitium in the kidney. Basically, you're going to reabsorb this into the bloodstream so you can reuse the glucose. Again, SGLT1 primarily in the intestine, SGLT2 primarily in the kidney, although the kidney has SGLT1 as well. So let's look at what they do in the kidney, because this is going to be the area that they're going to work for us to help us with our diabetic patients. So glucose is passively transferred into the kidney. So there's no active transport or whatever level you have in your bloodstream goes right into the kidney, and it travels through the kidney. And in a normal animal, most of the glucose is reabsorbed right at the beginning in the proximal tubule using an SGLT2 transport protein. So that's going to pull out 90% of the glucose that is in your bloodstream, basically, that's getting filtered through the kidney. So that's going to pull out most of it. The little bit that's left is actually pulled out by the SGLT1 protein. There's some in there as well, and that will pull out the additional 10% of glucose, and leaving you with no glucose in your urine. So when you urinate, there shouldn't be any glucose in it. So very smart pharmacologists said, okay, what if we make a specific inhibitor to this SGLT2 protein and we block it? What can happen then? Well, basically, none of the glucose is reabsorbed that comes into the kidney. So that's going to be totally blocked. However, the SGLT1 is not blocked. And so now it's seeing a bigger glucose load that goes down and it's presented to the SGLT1 proteins, and you get actually a 30 to 50% reabsorption of glucose from these SGLT1 proteins. Now, you're going to have glucosuria because you're not going to pull it all out, which is actually what you want in a diabetic. But because you've got your SGLT1 protein pulling some out, you're not going to get hypoglycemic. You're going to reabsorb some of the glucose and not get hypoglycemic. Okay, so that's kind of the basic mechanism of an SGLT2 inhibitor. These are a huge drug class in human medicine. And actually now when you talk to human physicians, they don't even, like using it for type 2 diabetes is almost passé for them. And they're really focusing on using these for cardiovascular disease because of the way that it manages sodium, and also for kidney disease. But that's people. We don't care about people. What are we doing with cats? Let's talk about cats. So there was bexigliflozin that was actually FDA approved in the US in December of 2022. And this is a paper that was published in the Journal of Veterinary Internal Medicine detailing the clinical trial that allowed the FDA to approve this drug. There were about 60 cats in this clinical trial. I will also say that this is an open access journal, and you can do a Google search and you can pull up this paper if you want to look at it. Velagliflozin, or Senvelgo, is the new drug on the market, and this was just FDA approved like a month ago. So it just got FDA approved. And the nice thing about Senvelgo is actually a solution. So it's actually a liquid that you can use, which a lot of cats obviously will take a lot easier than a tablet. This is a paper. Well, this is the title of an abstract that was actually presented at the ACVIM meeting this summer. That's the big internal medicine meetings. And it basically detailed the results of the clinical trial, which allowed the FDA to approve velagliflozin, or Senvelgo, a month ago. And I'm going to share some of the data with you from that because I'm one of the authors on this. And this is actually being written up right now for publication. So veterinarians often ask me, and as an owner, I think it's fair to ask too, oh my gosh, now there's something new that I have to learn about. There's all these things that you have to learn about all the time that are new and changing, and here's another new drug class. So is this really going to help me? Like, why should I take the time to learn about this? And I'm going to tell you, these are life-saving drugs. So how are they going to help you? They're going to help you a lot. One thing, they're oral. It's an oral medication. Owners do not have to inject these under the skin. The other thing is they're once daily. So now we've taken out the twice daily thing. And also, you do not have to time them with feeding. So they can eat, the cats can eat anytime they want to when they're on these drugs. They have not been shown to have any clinical hypoglycemia, so we can take that off the table as a problem. And you don't have to monitor them as intensely. So for any of you that have suffered through glucose curves, these are going to be much less helpful for us monitoring these drugs. Although we are going to have to focus a little bit more on looking at ketones. So there's going to be a little bit of a paradigm shift on how we monitor diabetics on these drugs. The other nice thing is that we don't have to teach people how to do injections, which is time consuming and scary for a lot of owners. And now we don't have to do that anymore. So can you use this in everybody? And the answer is no, you can't. They are certainly, the SGLT2 inhibitors are certainly appropriate for most cats, but not for everybody. And the cats they're not appropriate for are cats that, are cats that do not have enough functional beta cell mass. So when this decreases to a certain level and the animals cannot produce enough endogenous insulin, this drug is not going to work. They're going to get ketotic on it. So, and remember, we talked about how we need some insulin to prevent ketosis. If these cats cannot produce enough of their own, then you cannot use these drugs in them. And that's why these drugs do not work as a sole therapy in dogs, because dogs are type 1 diabetics and they don't have any insulin. So the cats need to be able to produce enough. And one of the issues with these drugs are we have no good way to predict which cat has enough functional mass. So we have to monitor them. We have to pick the right cats and also monitor them very closely. So do they work? Okay, that's the big thing. Like, okay, we're talking about all this stuff, but are you going to, like, we're going to ask our owners to pay money for something? We want to make sure they work. And what I'd like to present to you now is some data from a study called the Sensation Study, which was the study, again, that was used to produce data so that Senvelgo or velagliflozin could be FDA approved for cats in the United States. So I want to just tell you a little bit about this, and I don't want you to get too caught up in the weeds, but just to kind of let you know how the clinical trial went. And what I will reveal to you is that I actually did part of the clinical trial. So I did about 20 cats on this trial, which was the maximum number that were allowed in any single site. The rest of the cats were seen in general practices all across the United States. So I do have some experience handling this drug. So again, happy to answer questions about handling it as well. So there were over 400 cats that were screened for the study. 252 were allowed in the study. And as veterinary studies go, this is huge. It's so exciting to get to see so much data from diabetic cats that have naturally occurring disease. So it was so cool to see all this. So huge study. 28 were removed for non-velagliflozin related problems. So like compliance problems or unrelated medical issues. 66 were removed for potential velagliflozin related problems. They may not have responded well clinically. Some of them, there was a low percentage that got ketosis or DKA, or meaning they were a sick ketotic animal. And some of them had some adverse events that might have been due to velagliflozin. But 158 of these cats completed the study through 180 days, which is phenomenal study. So I'll show you some of the data. And again, I don't want you to get caught up in the weeds of it, but I wanted to let you see what's the kind of data you need to show to the FDA so that they will say this drug works, and also to convince you that this drug really does work. So the first data graph I have here are blood glucose. These are blood glucose measurements from blood. They're from glucose curves taken at 1, 3, 5, 7, and 9 hours after cats got velagliflozin. And these are means and ranges. They're typical box and whisker plots. So you have the mean here, or like the average here, the 25 to 75% range. The little whisker part of it is the 10 to 90% range, and then all the dots are outliers, statistical outliers. The important thing to, and I'm sorry, these are from glucose curves done on day 7, which is kind of the medium dark box, day 30, which is the light box, and day 60, which is the dark box. So there were naive diabetics included in this study. Most of the cats were naive, meaning they'd never seen insulin before. And there were also a small number of insulin-treated cats that were in the study as well. So this is the data from naive cats, meaning they were newly diagnosed diabetics. They had never seen insulin. And what I want you to notice are a couple of things. One is that by 7 hours after you give Senvelgo or velagliflozin, you can see that the mean of the blood glucose is already in the normal range, which is indicated by these dots here. So that is pretty cool. So it works fast. And also notice that as we proceed on these animals being on this drug longer, their mean starts out now in the normal range at like day 30 and day 60, and stays within the normal range all throughout the day when these were looked at with glucose curves. And this is a really good indication that we really don't need to monitor these guys with glucose curves anymore. And also to let you know how effective this is at keeping blood glucose down all day long. This is the same type of a curve, only these were the insulin-treated cats. There were many fewer cats like this. There were only 38, I believe, of these cats. So there's not as much data, but you can see that it follows the same pattern as we saw with the naive diabetic cats, in that by day 30, they're pretty much always within the reference range, and that we see a quick response to the Senvelgo. These were just spot BGs, and we included this data because it allowed us, they stopped getting glucose curves at day 60, but this allows you to see what happens at day 120 and day 180. And these were just random blood glucose measurements. Anytime the cat came in to be rechecked on the study, a blood glucose was pulled. And again, these are mean blood glucoses with your typical box and whisker plots. These are mean blood glucoses that were measured, again, indicating that these get into the normal range pretty darn quickly, starting out pretty high, get into the normal range pretty darn quickly, and they stay there. These are just fructosamine measurements to be complete with blood monitoring. Fructosamine gives your average blood glucose for the preceding 2 to 3 weeks. And we're seeing the same types of patterns in that. And it's the same between the naive or the insulin treated animals, that really we see a significant decrease by day 30, and it stays low through day 180. 81% of these cats had a fructosamine in the reference range by day 180. But we talk and talk and talk about that, but what's most important, and that's going to be the clinical signs. So owners at each visit, when they came in for the clinical trial, were asked if their animals' polyuria, polydipsia, polyphagia was improved or had it worsened since the start of the study. And these are the number of cats and then the percentages at each time period. So day 2, 3, day 7, 30, 60, 90, 120, and 150. And then we looked at polyuria, polydipsia, and polyphagia. I'll talk about neuropathy as well, but kind of separately. So you can see in each of these time periods, the cats that got better in comparison to before they started the drug, to what they look like at each of these time points. So the message here is that these guys' clinical signs improve pretty quickly. You're seeing an improvement even at day 2 to 3. They're getting better with their polyphagia and their polyuria, polydipsia, meaning excess urination, excess drinking, and excess eating. By day 30, there's even more of an improvement, and you can look at the numbers. By day 180, we've got improvement of, well over 85% of all the animals with drinking more, urinating more, and 70% with eating more. Cats get neuropathies. They can't walk correctly, and it's not as common a side effect, but we do see it, and I certainly saw it in 26 of the animals in this study. They either had it or they didn't, and this was scored by the veterinarian when they went to their visits as part of the clinical trial. And you can see that this resolved nicely over time as well. By the time of day 180, 77% of the 26 cats that had neuropathy had actually gotten better. 2 cats, however, did develop neuropathy, one at day 62 and one at day 156. So this is phenomenal. Phenomenal response clinically, phenomenal response glucose-wise. Okay, looks like a really exciting drug. It works really well. But you know what? Nobody wants to give an unsafe drug to any of their patients. So what do the adverse events look like? The biggest adverse event with this drug is diarrhea. Having said that, we asked owners to fecally score these animals, so they were probably paying more attention to the poop than they would have been normally. But 50% of cats had some degree of diarrhea based on the Purina fecal scoring chart. Most of these cats, it was very mild and very self-limiting and went away in a day or two. And only for 2 cats was that a reason why they were pulled out of the study, and those 2 cats had severe diarrhea. So diarrhea happens, but it usually goes away really quickly. Vomiting was the next common adverse event, which is not a surprise in cats. They throw up all the time, and when you give them a new oral medication, they almost always throw up. It happened 33.7% of the cats, but it wasn't a reason for removal from the study for any of them, so not severe at all. 8 cats got pancreatitis, so low percentage of cats with pancreatitis, but we always look for that. in animals that have diabetes, since many of them have concurrent pancreatitis. 3 cats remained in the study, so it doesn't look like that's a problem. And urinary tract infections, which I'm mentioning specifically because there's so much glucose going into the urine, not a big deal, and certainly not a larger incidence of that than we see with insulin treatment in cats. The other side effect that we see, which is a little bit different and has been scary for some people, but it shouldn't be, it should not be frightening at all, is euglycemic diabetic ketoacidosis. And I put a little cartoon in here to describe it a little bit. The first thing that I want to say is this is a really uncommon side effect. We don't see this very in the majority of cats, and we certainly don't see it any more than we do on diabetic cats, in diabetic cats that are treated with insulin. The issue here is that it's a little bit different than the presentation that we see with insulin. So basically, we know that cats get ketotic. When they're not making insulin, you have decreased insulin secretion and usually an elevation in another hormone called glucagon, probably representing some sort of stress or disease process that kicks it off. And fat has a huge breakdown into free fatty acids, which then turn into ketones. And we don't like ketones because they're acidotic, and also they cause a lot of a dehydration. So it's something that can make these cats really, really sick. The difference with what we see with an SGLT2 inhibitor is that instead of the animal being hyperglycemic when they get ketotic, like most diabetics are, these guys have a normal blood glucose. So it just changes the way that we need to treat them, and maybe the way that we recognize them. But overall, it is not, it's actually less common than if you were insulin treating an animal. And also, once you get used to it, you can treat it the same way, you just have to supplement glucose. So not really anything to be scared about. This is the incidence here. These are animals that just had ketones that showed up in their urine, but they weren't sick. Naive diabetics, insulin-treated diabetics. These are the ones that actually got sick. So they were labeled as DKAs, or diabetic ketoacidotic cats. And you can see the numbers here. And these were the combined numbers. And the bottom line from all this data is that if you're going to get a cat that's on Senvelgo, that's going to get ketotic and sick, so ketoacidotic, they're probably insulin-treated cats, probably because they have less functional beta cell mass than we hoped that they had. And they're going to get it in the first 2 weeks after starting Senvelgo. All right. Another side effect that we always worry about with insulin is hypoglycemia. And I can say there was absolutely no clinical hypoglycemia in any of the cats in the study, none. There were some low blood glucose measurements that were sporadic, and a couple of low fructosamine measurements that were sporadic, but nobody was clinical for it. So this is really nice, because it is a really nice thing to not have to worry about in a diabetic. Acceptance of medication was really good. 30 of the 30,000 doses that were given, 98% of them went in the first time. You can either give it directly in the mouth or mix it with a little bit of food. 1.3% were missed, and 0.5% were redosed, meaning that if the cat, like if you dropped the syringe or you weren't sure how much the cat got, or it threw up, you could actually redose it. But 98% of these cats got their dosage right away, and so there's very good compliance and acceptance with the medication. So in summary, I think this is like, drugs like this only come out like once every 10 to 15 years. I am thrilled that I get to be part of seeing our paradigm for treating diabetes in cats change, because it just breaks my heart when I have to euthanize a cat because the owners can't keep up with treatment. So this is really exciting times for diabetes. I think we're going to save a lot of lives of cats with this new drug class, the SGLT2 inhibitors, and consequently, I think we're going to improve many lives of many owners, because we're going to give them an option for treating their cats that they can actually comply with. So I'm hoping that when these drugs really get into use and when Semvelgo really gets used, that we're going to be able to say that we've stopped a lot of the euthanasia, and maybe that percentage of pets euthanized with diabetes immediately or within the first year of therapy that number will actually decrease. So with that, I thought I'd show you some pretty pictures. I got to go to Antarctica and about in the winter, this last winter, and some pictures of some icebergs and also of some Adelie penguins jumping in the water. And I'm happy to take questions and also leave you with information about the Every Cat Health Foundation. So with that, I am delighted to take questions.
Well, we do have a few. So,
Yay!
yeah, actually, we've got some really good questions.
Good.
This question, I think, is just asking, and this could be, it could be any, I assume, anesthetic procedure. What are the risks of doing, her specific question is a dental procedure on a diabetic cat, but I'm thinking, what's the risk of any anesthetic procedure, and what would you do ahead of time?
So I can answer that because it actually happened when the cats on the study had to have a dental. So it's the perfect answer for the question. Basically, what I did with that cat is, you fasted in the morning before anesthesia. We just did not give the Semvelgo that morning. It takes about 24 to 48 hours to get out of the system. So you do have a little bit of time. And we just did the dental procedure on the cat that day. And then we started them back on Semvelgo the next day and they were fine. So there shouldn't be any risk of not giving the Semvelgo. I just didn't give it that one day and started them back on it the next day when they got their food.
For cats that are not on Semvelgo yet, is there a risk, whether they're insulin dependent, if they're
So if you have
injectable
a
or
cat on
oral?
insulin, no. And honestly, there was a really great paper that just came out it was actually in Cats and Dogs, which really supports some data that we published in dogs, that really highlights how important it is to have really good oral health in terms of controlling diabetes mellitus, which I think kind of we all knew, but it hadn't really been shown yet. And there was just a paper that came out on it showing some data. So it is really, really important to keep up with oral health with these diabetics because it'll help your regulation. So having said that, if you have an animal on insulin, absolutely anesthesia is possible. So the way that I do it is, you fast them in the morning so they don't get any food, and then you just give half the dose of insulin. You don't want to take away the insulin completely because you can make them get ketotic, but you just give half the dose of insulin. And of course, you're going to monitor their blood glucose while they're under anesthesia, but usually that's fine. And then you just start them on their normal regime the next day with their insulin twice a day. If they eat really well after the procedure that night, which some animals do and some animals don't, you could give them a full dose of insulin. But if they don't eat well, then you just give a half dose. But in the morning before anesthesia, just fasting them and giving them a half dose of insulin works really well.
Awesome. Two questions that are specific to types of treatment. One question about how do you feel about glargine, and one about Bexacat. So
the
pros,
first
cons.
question, I'm sorry.
Pros, cons.
Okay. So glargine insulin is a great insulin. I love Prozinc as well in cats. It's a nice long-acting insulin as well, but glargine works really well in cats. There's a lot of data to back it up. I don't think it's the be-all end-all of insulin in cats, but it works really well and it is really inexpensive. So it is a good insulin to use in cats. The generic or even so I don't know how they do this, but the company itself sells a generic. So I don't even know what that means, but it is very affordable. And it works really well. So that is certainly a good option. I tend to go for Prozinc because it works well in my hands. And actually my cat is on once a day Prozinc. And it tends to work well in my hands. And I like using an FDA approved product because I know I'm protected if anything ever happens. But glargine works really well. And again, it's very inexpensive. So it's a good alternative to use if owners are very concerned about money. In terms of Bexacat is the same drug class as Senvelgo. They're both the same drug class. I expect them to work similarly. I presented the data on Senvelgo because it's it's not my data, but we're analyzing it to publish it, so I feel more comfortable talking about it. But certainly Bexacat has had the same type of response in terms of their clinical trial. Their clinical trial was smaller, but they saw the same types of things, and there's nothing really outstanding between the two different drugs, and they are the same drug class, so you would expect them to work similarly. I would say that the only difference that I could think of might be if the cats would not eat the Bexacat pill. That's one thing. The other thing is if the cat is smaller than a 3 kilogram cat, which most cats aren't, so it doesn't matter. But if it is a very little cat and less than 3 kilograms, you cannot use Bexacat. But otherwise, Bexacat also does not get dosed on weight, so they get the same amount no matter what they weigh. So that's kind of pros and cons, but really it's the same drug class, so it should work pretty similarly.
This is a question about cats that are on prednisolone, and do you have to discontinue prednisolone before starting the Velagliflozin or the Bexacat?
No, you do not. How cool is that? And in fact, that, in my opinion, well, first of all, if they're on prednisolone, when they're on insulin, what are you going to do? Take away the prednisolone? You can't do that. Like if the cat's got inflammatory bowel disease, sometimes they've got to be on steroids, right?
Yeah.
And so you can't take that away necessarily. So even if they're on insulin, you're going to leave them on the prednisolone, you're going to adjust your insulin dose like you have to. But if they're on prednisolone and you want to start them on Senvelgo or Bexacat, you should be able to just do it. And in fact, those treatments are ones that are probably better to use with an animal that's on a steroid just because of their mechanism of action. So absolutely they can be on those. It'll probably say in the product insert they should be off of steroids or whatever have you. And certainly in the study, they were not allowed to get steroids, but honestly, you can, and it'll probably be just fine and work better, I think. Like I said, if I had to pick using insulin with a steroid versus using an SGLT2 inhibitor with a steroid, I'd probably pick the SGLT2 inhibitor with a steroid, but you could use either if you had to.
Excellent. Excellent. Are hydrolyzed protein diets low carb?
I'm sorry, low carb versus high protein? Is that what the question was?
Well, the question is, are they, I think in general, the question is, are they low carb aside from protein? Are they low carb?
So what you want, and I have many nutritionists are so smart, and I have many very smart nutritionist friends, and what they will tell you is you want a low carb diet. It doesn't have to, people always say, oh, it's a high protein diet. That's not the important thing. It's a low carb diet. And of course, the calories then will be met by adding either more protein or more fat in there, and probably having more protein is better. But what you want is a low carb diet. And again, if you had to pick a diet, the first thing is to calorie control them. That's probably more important than the type of diet. But once you're willing to calorie control them, I think most people feel that a low carbohydrate diet really, really helps cats. And as I said, it can probably help normal cats that are not diabetic lose weight as long as you calorie control them.
I think the question she was wondering is she's got an IBS cat. So, and I'm guessing the diet that it's on is hydrolyzed protein.
So if you have a cat with like inflammatory bowel disease that's on a hydrolyzed diet. Okay, if you have a cat like that, you absolutely have to feed that cat the hydrolyzed diet. And then you make adjustments in your insulin therapy, or you do the best that you can with your other type of therapy. I mean, ideally, a low carb diet's nice in diabetics if you don't have to feed for anything else. But if you have a cat with IBD that you're feeding for, or a cat with chronic kidney disease that you're feeding for, those are more important because the food is such an important therapeutic part of the therapeutic regime that the low carb diet is much less important. So you absolutely would not want to take a cat like that off of the hydrolyzed diet because that's really helping the disease.
Excellent. This is kind of an interesting question. Do you feel that it's okay to pre-fill Lantus syringes? Or is there a problem with something in the syringe that might contaminate the insulin? That's an
Yeah,
interesting question.
that is a great question. And I am going to say that I'm not positive about this, although I bet you can Google it because I'm sure it's out there. My guess is that some of the plastic and some of the syringes might break down that insulin. The other thing I'll say too is if you look at, I guess that's not true with glargine, but if you were using an insulin that was like in a suspension, like Prozac, if you pre-fill syringes with that, sometimes it can kind of sediment out and you don't actually get the whole thing in the cat unless you like shake it up in the syringe, which is hard to do. But I have this feeling in the back of my mind that the plastic over a long time period may interact with the insulin so that it's not as stable, and you probably shouldn't leave it in the plastic like that, but I'm not positive. So I'm not sure.
So that's how expensive are these glyphosins?
Yeah, the SGLT2 inhibitors. So I think I just found out the price of the Senvelgo is going to be a little over $200, I believe, for a 90-day supply for a cat. So if you have, I'm sorry, for like a 10-pound cat. So if you have like a 10-pound cat, I think it's between 200 and 250, somewhere around that range, to treat them for 3 months. That's how much Senvelgo is going to be. My guess is, I'm not positive on the price of Bexacat, but my guess is it's probably going to be in the ballpark. So that's probably what you're looking at.
But again, with these, we don't have to do the glucose curves and all of those
Bingo.
that
Monitoring is
cost all the extra
much,
money too.
right.
Yeah.
And you don't have to buy syringes, and they also don't have to be refrigerated. So convenience is certainly out there for sure. So they're not prohibitively expensive by any means. And again, you're also saving money on having to do a lot of glucose monitoring.
Yeah. I know for a lot of my clients back when I was still in practice, that was the biggest concern, was how much, trying to get them regulated cost, before you could even say they're ready to start, do you have to do you have to test before every dose like you did with insulin?
No, that's the other nice thing. You don't, you just give it. It's so easy. You just give it, and you don't have to time it with a meal, which is really nice.
You mentioned that.
So they can eat. And, I think for years for a long time, we try to get cats to meal feed, and some cats will, like my cat does. Some cats will. But there are a lot of cats that are just not going to do that. They're going to be grazers. And so I think a lot of us, even with the use of insulin, we're saying, okay, well, we're just going to have grazers and we're going to have to deal with it, because you will never win an argument with a cat over eating, at least in my opinion. Like, they win every time. So trying to convert a grazing cat to a meal fed cat, in my opinion, doesn't work. And with the SGLT2 inhibitors, that's more set up for a grazing cat anyway. So they absolutely can eat anytime they want to, which is really nice.
In the studies, were there cats on that were currently on insulin, correct?
Mm-hmm.
Was the insulin discontinued at the start, or was the two continued for a period of time?
So the insulin was discontinued at the start. And in my mind, maybe not optimally. So they just pulled him off the insulin one day, and then they went on the velagliflozin the next day, which, if I had designed the clinical trial, I might not have done it that way, because it seems kind of harsh to do that. Like, one day you get insulin and the next day you don't. And we certainly know in a lot of cats that can cause ketosis. So I'm also wondering if that didn't contribute to some of the ketosis that we saw in those cats. But no, they were not on insulin, and the SGLT2 inhibitor at the same time. That is not currently recommended. And I would say it's my guess is, in the future, we might have populations of cats that we're treating with insulin and an SGLT2 inhibitor, just like they do in people. But until I think we get used to the drugs, they're probably safer and more effective. Well, they're probably safer as a sole therapy until we start figuring out how they really work.
Excellent. and get more data too.
And get more data. Yep.
Cats that are treated with the SGL2 inhibitors, can they go into remission the way that some cats on others?
Yeah, that's such a great question. My guess is they do. We don't know because the cats were not tested for that. And the only way to know these cats went into remission is to take them off the drug. That's the only way you're going to know.
Oh, good point. Okay. Okay.
And they don't get hypoglycemic while they're on the drug. So there you will never know unless you pull them off. So I had a few cats that came off the study that I treated, and they went into remission for months. A couple of them did. So my guess is it does cause remission. The other reason I think it causes remission too is because of the response that we saw with the neuropathies. They did so well, much better than I'd expect to see with insulin. And so I think a lot of cats will, but we have no idea what that number looks like now because these studies weren't designed to look at that. And I will say, being a new drug class like this, you can anticipate that there's going to be 1,000 resident projects looking at these drugs and what they do. And we're probably going to know a whole lot more about them in a couple of years. So again, we don't know what the remission numbers are. I can tell you, I can almost guarantee you that there are going to be cats that will go into remission on this drug. I just don't think we know what the percentage is.
Okay, that's fair enough. This is an interesting one. Can Bexacat and Senvelgo be used interchangeably or sequentially, one then the other?
That's a great question. I'm going to have to say we don't know because it's never been done. My guess is they can. They're the same drug class. I don't know what the absorption looks like in them, but the kinetics that I've seen, it seems like they last about the same time. The blood glucose kinetics look similarly. So I don't know that I would take a cat and like give it some Velgo one day and Bexacat the next day, because I think you're asking for them to vomit and get diarrhea just because of the different ways the drugs are presented to the GI tract in cats, and cats are so sensitive. But I think that they, being the same drug class, they probably could be used sequentially. So if you like finished up with Bexacat and you said, oh God, this is not working in my cat, I'm going to switch to Senvelgo, my guess is you probably could.
But not together.
Oh, no. I wouldn't get
okay.
together. I think that would be mean on the cat's GI tract to do something like that.
Yeah, that'd be okay. Do we need to continue a low carb diet on the Senvelgo?
Yeah, that's a great question too. And the answer is we don't know. In the Senvelgo trial, the cats were not necessarily on a low carb diet. They were asked to have been on the same diet, I think 3 weeks, 2 to 3 weeks before they started the trial. And then they were kept on the same diet at least through the 60 days, the first 60 days of the trial. And so cats were receiving a whole bunch of different diets. So we couldn't figure out who was on low carb and who wasn't. We tried to look at it, but you can't tell because the diet formulations change all the time. So the answer is nobody really knows if they need to be on a low carb diet or not. My guess is I just think cats do better on low carb diets, period. So it's probably what I would go for, unless you have another problem, or, you've got a CKD cat or you've got an IBD cat and you're feeding for those diseases, then of course that's going to be more important. But my guess is for a lot of cats, a low carb diet's a good thing.
So this one is, can you talk about or provide a resource regarding monitoring on this drug? For example, a cat that is already on insulin, but the owner wants to switch, is it possible with cautioning of unknown beta cell concentration and possible adverse events?
It's a great question. And the answer is the label will tell you cannot switch. But obviously it happened in the clinical trial, so we know that you can. I think that for many owners who just say, I'm not doing an injection anymore, and they need to have an oral medication, then you absolutely should switch them. There are a ton of I've seen some of the Bexacat literature, and there's literature that's going to come out. Senvelgo is actually going to be launched in the US at the AAFP meeting. So that's in a couple of weeks, and it can be on the shelves probably in 3 weeks. So you'll have access to it. There is a ton of guides to help you start the cat, what exactly when to monitor, what days you need to monitor and what you need to monitor. And also, they're not going to give you a guide to switch from insulin to Senvelgo because they're not promoting that. But I think you absolutely could. If I were doing it, I'm not sure that I would kind of cold turkey it. I think what I would do, again, monitoring their blood glucose, monitoring their ketones, which you can do with those handheld monitors, with just an ear prick. But I think what I would do is not just cold turkey them off the insulin. I'd probably give them a half dose of insulin with the dose of elogliflozin and do that for one day before I just took them off the insulin. So they had a day of like half insulin and starting to get some glucose lowering before I dumped them, I just pulled them off. But I don't have any evidence to say that that works any better than just taking them off. That's just my opinion.
Hold on. Okay, so we're getting kind of to the end. We're 10 after already, and I do want to respect your time. Do you know any idea of a timeline for release in Australia? So obviously we have somebody from Australia. Thank you. Hello.
Yeah, hey, there are some diabetes. You have some great diabetes people in Australia. Let me tell you, I was just at the ECVIM meeting with one of them. They're fabulous. So the answer to that is no. I have no idea. I know that it's been approved in Switzerland, in the UK, and I think that's it so far in Europe. And I don't know when they're going to have it released in Australia. So I wish I did, but I don't.
Well, I like to think that if it's already approved in the UK, then that tends to be I don't know, as far as I'm concerned, tends to be the beacon then
You know
for
what,
Europe.
you would think that, but you know what? It's funny. They have very different rules. And we were just in the ECVIM meeting in Spain. And because it was not approved in Spain, we could actually not use the word Senvelgo in Spain. Like you couldn't use it. So it's very interesting how all of that works. But I did speak with somebody from Australia and we did ask that question. It seems to have to be approved differently than the UK drugs, I guess. So that's the word that I have.
Okay. Good answer then. Let's see. Why are calories so important when they are literally starving as a diabetic? Good question.
Yeah, that is a really good question because you're right. They probably shouldn't be using their calories at all, right? When they're diabetics. They still have fat cells though, and they're breaking them down, that's for sure, when they're diabetics. So what we tend to want to do for diabetics is we want to give them enough calories so that we actually rebuild their muscles. Because remember, they're breaking all their muscles down trying to give themselves energy because they're not able to use any of their carbohydrates. So when you start switching them over, I think that's when we run into problems, because when we start then allowing them to be able to use their carbohydrates, and we start providing that food for them when they're using their carbohydrates, as soon as they get insulin, then they change right over and they're able to use their calories better. So the idea then is you don't want to overfeed them, even if they've lost weight with their diabetes. You don't want to overfeed them because again, you don't want them to gain any more fat than they need to. So that's why we just recommend calorie controlling them, because really the insulin that you're giving them or the velagliflozin or bexigliflozin that you're giving them is going to change them over to be able to use their carbohydrates. And so you're sort of switch them over, and that's going to kind of take care of replacing their nutrition, and you just don't want to overfeed them.
2 more questions. Is that okay? And then we'll call it
absolutely.
good. Because this one I think is important. Have you used B12 for treating diabetic neuropathy?
Yeah, I have. And I know people talk about it. I'm not sure it makes that much difference. I know I usually use it because it's not going to hurt anything and we just want to do everything that we can. But the data behind using it, and do I think it really works? I don't know. I think it's one of those things you do. Maybe it helps. I don't know, but I certainly don't think it's a miracle drug. The good thing is B12 never hurt anybody. So giving them a shot of B12 isn't going to hurt anything. And if it helps, well, then great.
Good answer. How often do you monitor ketones? Can it be done at home like glucose can?
Yes, it can. There's a great ketone meter. And regardless of what other people have tried to tell you, there's only one that has been approved for use in the cats, has been validated. And it's the Abbott Precision Extra. You use it just like a glucometer. So you can do, in fact, I got one because I'm monitoring my own cat this way to make sure it really works as well as I thought it did. And you can just do an ear prick and you can get enough blood from that to actually get a reading on this ketone meter. They're really cheap. You can get the ketone meter itself and 30 test strips for $50 on Amazon. The meter itself is like 30. And it's just like using a glucometer. You stick the strip in the machine, you do an ear prick, you get a drop of blood, and then you get a number that's read out. So very easy to do. Owners can do it at home. If they can do a glucometer at home, they can do the ketone meter at home. I usually recommend people doing this day 2 to 3 after you start the Senvelgo or the Bexagliflozin to make sure you pick the right cat. Because again, we don't have a test to say who's going to be the one with enough functional beta cells. And then probably at day 7, then day 14, then probably day 30. And then you can do it like every 2 to 3 months after that.
Fantastic.
Yeah, very easy.
So much has changed, but there's so much still that we need to learn, obviously, right? So I know we've got a few questions that I didn't get to, and I really apologize. I really appreciate your time. I want to thank BI, Boehringer Ingelheim, for sponsoring this webinar. They have also agreed to match our donations for our Cures for Cats campaign, which is in support of diabetic research. All of the money raised from that will go to fund diabetic related, feline diabetes related research projects coming up. But they're going to match every dollar up to $40,000. So we could potentially have $80,000, which is at least 2 studies. So if we can get that money, that would be great. In the chat, there is a link that you can go to donate. I appreciate everybody's questions. We've had some great questions. I appreciate everybody's time. This video will be available in a few days on our YouTube channel. And also, if you are a veterinary professional and you need CE, you will get a follow-up email in the next day that will tell you how you get your CE certificate from us. So yeah, I think that's everything I've got. I'm getting lots of hearts here. People are really appreciating and if anybody's going to AAFP, stop and see both of us. We'll both be there.
Oh yeah, that's the other thing I wanted to tell you is Boehringer Ingelheim's actually sponsoring a whole diabetes masterclass at AAFP. It's in the pre-meeting. That's the
11th or the 12th?
It's that Thursday, whenever that Thursday is. I think the meeting starts on Friday, and whatever that Thursday is, it's going to be a diabetes masterclass.
So that'll be the 12th.
If anyone wants to come and learn more, we're doing a bunch of stuff, and then and I know I'm giving a talk on Sunday about this. So anybody that's there, I'd love to meet all of you.
Excellent, excellent. Again, thank you so much for your time, Dr. Ward. I really appreciate it. I've learned a lot, and it is such an exciting time
very exciting
to be a part of this. And again, I think the next research project is how do we tell whether there's enough beta cells or not? So
there we are.
Somebody send that in. All right. Thank you very much. And thank you everybody for sticking around. Have a great evening.